Okay, so we're gonna first start using our little navel oranges as our skin, and you're gonna remove a mole that looks like cancer. And first we're gonna learn how to make an incision around it. It's an elliptical incision, so you make it like an eyeball. Just cut to the dermis, not too deep. Yep. Good. And then you take your forceps and you take out that piece of skin. Good. Okay. And then pause it. So now you're going to pull the needle out. You just grab the needle. Normally you'd have gloves on and be sterile, and you're going to grab the needle by the end of it and have it hold it so that your needle is, yep, just like that. Okay. But you want, since you're right-handed, you want the needle to be pointing that way. And hold it with the tip of the yep. All right, so you want to start in the middle of the incision, and you're basically making a half circle.
How far out?
Swipe, and you go out. So you want to go out about 3 millimeters, 2 or 3 millimeters from the incision, and use your wrist to come out the exact same distance from the other side. And if it's a little bit farther, it's okay. That's perfect. Let it go, undo it, and then push it through. It's better than mine. And then you pull it, but don't pull it all the way through. Pull it, keep the needle in the, yep, until you got about an inch or 2 remaining. Okay. Now you can unhook the needle, and you're using the tip of your needle
on the long side.
Mm-hmm. No, put the forceps in the middle, and then you wrap it around once and grab the end of your suture, and then pull it through. Yep, exactly. And you want it kind of tight, but not too tight that it's going to rip through the skin. Perfect. And let go. And then keep hanging onto the thread with this hand. Then you're going to do it backwards. So you go backwards. Nope. Always be in the middle of the knot. Yep. And then grab it.
Grab the other side.
Grab the suture, the end of the suture. Yep. Exactly. Grab it and then make your square knot. Yep, just pull it kind of tight. Pull it there. Perfect. And then do another forward one. Usually you only need to do 3 knots to make it a secure stitch, or it's not going to come out. Grab that, pull it through, you're good. Pull it tight. And then if you want to practice and do another backwards one, you can. And pull it tight. Yep, and then grab your end and pull it through. Peyton, you're natural. Okay, so you pulled it tight. Now you want to take your scissors. You can use mine. And you want to cut so that there's just a little bit remaining, about 3 millimeters or so. And you don't want to cut, yep, so that's your stitch. Good. Now we'll do 2 more because you want to have, you don't want to leave an incision way like unsutured. So we'll do a couple more stitches and then we'll videotape when you're done. Go ahead. So Peyton's put in 3 interrupted stitches. Very good. And she's doing, as you can see, is just as good as I did. And I'm going to show her how to remove the stitches now. When you're in a clinic and you're going to remove the stitches, first of all, you wait about 10 days for anything on the skin that's not the face. You just go underneath the stitch, snip, and then you pull out the knot so you don't leave the knot in the skin. You can try it. So you, just put this right under the edge. Yep. There you go. Now you know how to remove stitches. It's smart. Alright, good job.